The city of Chandigarh now has its first pollen calendar, which may identify probable allergy triggers and provide clinicians and allergy sufferers with a comprehensive understanding of their origins, helping them to restrict the exposure during high pollen loads. Researchers from the Postgraduate Institute of Medical Education and Research and Panjab University have created a pollen calendar for Chandigarh, arguably the first for any city in India. The lead investigator of the study, Dr. Ravindra Khaiwal, Additional Professor of Environmental Health, Department of Community Medicine and School of Public Health, PGIMER, spoke to PBNS to explain this pollen calendar and its role in preventing allergies.
We need to understand that pollen calendar represents the time dynamics of airborne pollen taxa in a graphical form. So we collected the pollen sample over a period of 2 years and then try to look at which species dominate during which period. And this information will be very useful for the people, those who are suffering from the seasonal allergy or allergic rhinitis or pollenosis. And definitely this will also be helpful for the clinicians so that they can properly guide their patient with pollenosis so that they can prevent it.
A pollen calendar provides a clear understanding for clinicians as well as people with allergies to identify the potential allergy triggers and help to limit their exposure during high pollen load season. Dr. Ravindra Khaiwal further explains that the concept is not essentially new. Europe, UK and the US are already using regional pollen calendars in a big way to prevent and diagnose allergic ailments.
The concept is not essentially new. It has been largely used in Europe and America, and there is a early warning system is also. But to the best in our knowledge, in recent time, this is the first time in India where such a extensive work has been done for over a long period of time. Now, indeed, we have 4 years of data, so we will be updating it on regular basis, and we will be looking at more new species. We also need to understand that pollen calendar are location specific. Basically, they mainly represent the flora which is distributed in that particular locality.
Professor Dr. Ravindra Khaiwal talked in detail about the key findings of the study, which highlighted the variability of crucial pollen times in different seasons. The findings will enhance the understanding of pollen seasons, which will in turn help minimize pollen allergies.
As I said, first thing was that we identified the maximum pollen concentration, means how much it varies. So we noticed that apart from few particles to 800 particle were the maximum in 1 meter cube of the air of various species during the peak pollen. Another finding was that we identified 74 taxa and related species in this pollen. The third was that there were certain species, if we talk about like Chino Kodesi, marijuana, hackberry, safeda, white mulberry, we also call satut, congress grass, pine and grass pollen. And what is their peak month? Like grass pollen, you will almost find them except December the whole year. So this was interesting. Talking about cannabis, basically January to November, so it was having a long period. Apart from this, actually we also noticed that we were getting eucalyptus pollen all over the, you can say, monitoring period, and we understood that even when there is no pollen season in Chandigarh, the neighboring hilly area was also contributing. So there were long range transport of the pollen was also taking place.
He further shared his views on why there is an increase in pollen-related allergic ailments nowadays, especially in kids, and under what circumstances one should consult a doctor or an allergist.
We need to understand that over a period of time, there are a lot of chemicals which are being introduced into the environment, and air pollution is also increasing and becoming a major risk factor to our health also. So we need to link between climate change and pollen. So there are studies which are reporting that the pollen duration, intensity, all will vary and their pollination period will be longer. And for their survivability, they shrink and they change their size and shapes. So all these may be responsible for the allergic response along with the increase in the air pollutant level. children are exposed to emerging or new chemicals. You know that over a period of time we introduce so many chemicals, and their surrounding is now basically contaminated. So that is what some children are becoming more and more exposed. Another thing is that our immunity is sometimes also compromised due to various other factors, and that is the reason that probably the children are becoming more exposed, including the dietary and environmental factor basically. You will notice that many people have sneezing, running nose or mucus production, cough. They can also have red, itchy or watery eyes. So either you have basically atopic dermatitis or fatigue, and I will say nasal inflammation, then you must consult your doctor. Another thing is that if you feel like, if I go to this particular garden for morning walk or this particular area and then I feel allergic or these reactions basically, so you must understand that you may have this seasonal allergy or allergic rhinitis basically, and you must consult your doctor, because these adverse reactions and the allergies are preventable through proper treatment. So there are allergy sorts available, there is a immunotherapy is available, so we can really minimize the suffering of the population from these allergic disease.
The study was supported by the Department of Science and Technology, DST. Let's have a look at what Ravindra Khaiwal has to say on this and the support he and his whole team has received throughout their journey.
The Department of Science and Technology funded this project, and where we wanted to look at how the pollen concentration varies, how is it affected by the air pollutant, and what will be the impact on the COPD and asthma patient. COPD means chronic obstructive pulmonary disease patient. So with the support of the DST funding, we try to understand this relationship, and many studies are on the way which will formulate relationship between the meteorological and air pollution and its impact on COPD and asthma patient. And first outcome is the pollen calendar. I would like to thank my team. First of all, Akshi Goyal. She is a PhD student and she was working in this. Apart from our project team, basically, she was included in this study. Then Dr. Suman Moore from Panjab University, and my own colleague, Dr. Asutosh Agarwal from the Department of Pulmonary Medicine. We formulated a team, and a young dynamic student, Sahil, also helped in pollen collection. Basically.
He also explained to us what kind of steps must be taken to minimize such ailments and why plants with low to moderate pollen production of trees must be grown alongside our roads or in parks while planning the city. It is important to involve experts while designing parks or cities, and we should try to plant trees, shrubs that release no or little pollen.
You know that we need to have proper planning. And through proper planning, basically, we need to plant perfect flowering plants, means male and female on the same flower should be on the same plant, basically. Then planting these monoecious plants, which offer an additional advantage over deciduous plant, because they have distinct male and female, so it will minimize the pollen, you can say, spread. Then we need to select plant with low to moderate pollen production. We need to also study the allergic response of the pollen, potential allergic response, and those species which are having least, you can say, pollen allergic response, they should be planted, and we need to regulate invasive species. So through this, basically, we can minimize the pollen allergy. Basically, city planning is a major responsibility. So we should involve all experts, like who design the proper landscape, expert having proper knowledge on plant species, and then plantation in the city should be checked, and tree or you can say those who are having less pollen should be planted.
So that's it for now in our exclusive conversation. Stay tuned with PBNS for all the latest news updates. Thank you.